Welcome. I can see people are starting to come into the session, so welcome. We'll give everyone just a couple of more moments to settle, and then we will start. I can see quite a lot have joined us now. So, first of all, welcome. We're really delighted to be here today and have another opportunity to explore some of the best practice from our Picker Experience Network Awards that were run last year in October. My name is Ruth. I'm one of the founding directors of the Patient Experience Network, now part of Picker as the Picker Experience Network. And I'll be looking after you today. I'm joined by Helen, who will be, as you will have met her already, as she was part of the process to welcome you to the session, but she'll be looking after the inbox, the questions, and anything that we need. If you've got any problems or challenges, just let us know and Helen will look after you. Today, we are planning, and I'm just going to move slides, and now it's not moving. So let me just move that forward. Our goal is that by the end of the session, we've had a chance to really explore what sets award-winning patient experience work apart. So what are the messages that are coming out of the best practice examples that we'll share today? And we'll learn directly from the teams who've been delivering and sustaining that best practice. You'll hear about potentially some transferable ideas, some things that you can apply to your own settings. And hopefully you'll also have an idea of how that journey came about. What were the challenges, what were the enablers, and some of the lessons learned along the way that might enable you to do your own meaningful award-ready improvements. In terms of the way that we are going to move the session forward, Helen, could you move me forward again? I'm going to have to just say next slide, please. Our goal today is have a very quick welcome. Then we'll very quickly look at some of the emerging themes. So over the awards, we wanted to have a look and see, well, what are some of the consistent themes of things that people are doing that have been part of this year's or last year's best practice submissions. We'll then move to putting the spotlight, if you like, on our overall winner, and I'll explain a little bit about how we identify the overall winner, and then we'll move into some category winners and showcase their best practice. At the end of each, if we'll ask if you have any questions, and it'd be great if you could put those into chat, and we'll ask our speakers to respond to those, but we will also formally have an opportunity for some Q&A. So I have some questions that I have planned to ask the speakers, but we will weave in your questions as well and hopefully have time for any of your additional questions. We'll then wrap up quickly with some next steps, and our goal is to close promptly at 2 o'clock today. As I said, if you have any questions or comments, please do put those into the chat. Next slide, please. It would be remiss of me to go ahead without introducing you formally to Picker. So some of you will know Picker very well, some of you may not. Penn became part of Picker in April of 2 years ago, actually, so almost 2 years. So Picker is an organisation, it's a charity that has been around for many years. And very simply, Picker's ambition or mission, if you like, is to influence, inspire and empower. So Picker are there to influence policy and practice so that health and social care systems are also always centred around people's needs and preferences. We want to support people to inspire the delivery of the best and highest quality care, developing tools and services that enable that to be better understood. And our ambition is also to empower those people who are working in health and social care to improve experiences by effectively measuring, acting upon, and taking improvement forward. We're both based in the UK and internationally. Our work is founded in our 8 Picker principles of person-centred care, and you can see those here. I'm not going to spend much time on these. They are on our website, but they are at the heart of pretty well everything that we do. And when you look at them, they've stood the test of time, they've stood the test of culture, and they've worked around international organisations. What's interesting is one of the pieces of work we're doing at the moment is to work out whether they stand the test of digital, because of course we're in a very different world with AI and digital and technology moving forward very fast. So we're currently just reviewing our principles to make sure that they stand up to the technology or the digital world that we're in. But if you'd like to learn more about our principles, please go onto our website and find out more about them. You may know Picker for their measurement. That's where Picker has perhaps had their biggest presence, particularly in the UK. So really thinking about driving improvement by measuring what matters. And of course, Picker run many of the national surveys and many of the local surveys. But Picker do a lot more than that. And this is where PEN, or the Patient Experience Network as it was, comes into play. So PEN falls within the Connecting Communities to Inspire Excellence. So this is where we are looking to build forums, networks, recognition of award-winning programs, and supporting people to improve and bringing communities together to inspire excellence. But Picker also do work to build capacity. So looking at how we can grow person-centered practice through supporting people through the development of skills and capabilities with practical tools to support that. And then we're also looking at how we can enable transformation through person-centered approaches in terms of helping organizations understand where they are on their journey. So how mature are you? What are the standards that we should be working towards? And how can we really empower people to move forward on the journey in a way that they wish to? So that's a little sense of what Picker is about and how PEN fits in. So today you're going to be hearing about the Patient Experience Network Awards. And from last year, we are going to showcase 5 of our winners. The awards are open. So if you're inspired to take part as a result of taking part today, please go to our website. But the awards are the first and only awards programme to really focus on best practice and patient experience. We wanted to rebalance the conversation and have a chance to celebrate, recognise and share the good practice that we know is working in many organisations every day. It's both available both in the UK and abroad. And we, as I said, it's open. So if you're interested in finding out more, please go to our website with the date of our awards event on the 1st of October, which is a date to definitely put into your diaries. So I promised you that we would look at some of the themes that came out of last year's awards. And I just wanted to do that very quickly before I hand over to Sinead, who will be telling you about their best practice. So in our awards, we are very privileged to have insight into some of the amazing work that's being done across the world to improve the patient experience. And I include, when we talk patient experience, we are including in that carers and family. And it's kind of a catch-all phrase, which includes, of course, staff experience. And while we've got some amazing examples of very specific specialties or very specific projects, and they're all on our website, all of the finalists are on our website. What we wanted to do is just step back a little bit and have a look about, well, what are the themes? What are the patterns that are emerging? And what are the strongest points that seem to be consistent across these best practice examples? And so we found that the first was a relentless focus on real experience. So this is not about assumptions. So the strongest teams we were finding really start with not where they think the problem is, but what the people are telling them. Sometimes that can be quite uncomfortable, but that's where the difference is. They're not just collecting data, they're acting on it. And they change because of what they're hearing. And I know these sound obvious, but these are the themes that when we look and scratch below the surface across the hundreds of examples that we have, they start to come out consistently. So that relentless focus on the real experience, not what we're assuming, and really acting on the feedback. The second is about co-production. And I know for many of you, co-production is becoming the norm. But what we see in our best practice examples is that co-production it's not optional anymore. And what we see is it's being used in a much more meaningful way. It's not about asking people at the end of the process. It's about designing with patients, carers and communities right from the start, even before you've decided to finalize the idea in many cases. How do we bring patients and carers and communities into the decision making earlier? And one of the themes is that these organisations have done that. The third is around access, equity and communication. So it's solving those gaps. And again, this may not be a new idea, but what we're seeing as an emerging theme is that these are the organisations who are doing that and really asking the questions: who is struggling to access our care? Who isn't being understood? And who's being left behind? And we see that's coming through as an emerging theme. And then designing specifically for those groups. So whether it's language, literacy, neurodiversity, sensory issues, really doing a deep dive into understanding that and working out how can we address those issues so that the experience isn't treated as a generic experience, but something that really breaks it down. The fourth, as you can see, is staff experience. Again, not a new theme, but what we see is that staff experience as an emerging driver or as a theme coming out is it's a driver and not a side issue. So sometimes we see staff experience kind of separate from patient experience. But what we see with this fourth pattern is that the direct link between staff experience and patient experience, and actually you'll see that come to life in one of our case studies today. So best teams are not treating these as separate agendas. They're understanding that they're intricately linked. And actually, if we invest in staff experience as delivery, that will deliver us better care. The fifth is technology. Obviously, technology is all around us, but this is about using technology with purpose. So although technology shows up in many of our projects, really understanding how we use this. So it's starting with a problem and then exploring, well, how can tech solve that problem, as opposed to using tech for the sake of using tech. Next, it's systems and partnership. So this is where we see quite a few of our best practice examples are really exploring, well, how do we engage across the system? How do we build partnerships across teams, across organizations, but also, as I said, across whole systems? So not thinking about the experience within the silo or our piece of the puzzle, but actually starting to work out how it translates across different areas and working together better across boundaries. Again, perhaps not surprising, but the next theme is around really going from an idea, which of course is important, but it's not about having good ideas. It's about how do we implement that and really exploring how do we measure the impact and knowing that you're going to need to do that from the start. So from our best practice submissions, we see that many of these organisations are starting with the end in mind and working out, well, how and what are we expecting to see a change as a result of this, and how do we measure that right from the outset and build it into our thinking. And then the final one is around, again, perhaps not a surprise, but already at the beginning of the project, starting to think about, well, how can we make it sustainable? How can we make sure that this isn't a one-off? And designing these projects to last and be spread. So I just wanted to set the tone before I hand over to our speakers today. And so as you're listening to our speakers, it's really thinking about, well, where did they start with the real insight? What did they do differently because of it? How did they really share and co-produce and share the power and co-produce? What barriers did they remove? And how do they make it work in practice and in partnership? And what has made it sustainable? So I would like at this point to hand over to our first speaker. So our first speaker is Sinead Hannon. Sinead comes from Southern Health and Social Care Trust, and Sinead's project, Seasons of Life, was not only its own category winner, but went on to win overall. And the way that works is that at our awards, we have all of our category winners present, but then from that, both the judges and the audience get to select who was the overall winner. And Sinead with Seasons of Life was the winner for 2025. So Sinead, may I hand over to you, please?
Many thanks, Ruth. Thank you, everybody, and thank you for this opportunity to talk about our project. So I'm Sinead Hanna, I'm Paediatric Psychology Service Lead within the Southern Trust, and Michelle Mooney, she's our project coordinator. Unfortunately, couldn't be here today, but she'll be thinking about us and wishing us well. So next slide, please. So bereavement is a significant public health issue, and it can have long-term impact on children and young people. Research has shown that 90% of children have experienced some sort of bereavement, whether a close family, friend, or a pet. But it is also a hidden need. International studies estimate 80% of youth in need of psychological services never actually access those services. Early intervention is vital to prevent more long-term complex needs developing and continuing through childhood and into adulthood, impacting not just on mental health and disability services, but also on health services themselves due to the physical manifestation of emotional distress and trauma. There are numerous risk and protective factors that we can influence, and it was for this reason, in collaboration with our service users, that we applied for Q Exchange funding to develop and deliver one-year service aimed at improving the children's grief journey. Next slide, please. So this is our Seasons of Life team. Our project was very much driven, guided and accountable to both our steering group and our operational groups, which were established in partnership with service users, parents and young people, with health services across multiple directorates, with education and with crews from the voluntary and community sector. Next slide, please. So we very much embedded QI methodology and co-production within the whole heart of the programme. And the principles were to design, test and refine a psychologically informed intervention with the aims of enhancing coping and building resilience, increasing children's understanding and confidence in managing loss, empowering young people to have an active role in managing their own well-being, and bringing bereavement support staff to young people within their school environment as a warm introduction. Next slide, please. So the Seasons of Life workshop was very much co-designed with the young people. So the intervention itself with young people who had experienced bereavement. So it was collaboration between different disciplines and different agencies within trust, education and community and voluntary sector. And all the workshops were delivered within schools. We adapted the Tree of Life intervention developed in the Dulles Centre in Australia, which is a narrative therapy-based approach, which uses storytelling and creative activities to explore and witness stories of strength and challenges. We incorporated some processing methods in terms of psychological interventions for processing grief memories. And we also incorporated grief education and information on accessing further supports that are available for the young people. The workshops were delivered in a safe, peer-based environment so that we could start to look at normalizing grief experiences and fostering connections among peers. Over time, we extended beyond bereavement as we could see there was a need for support for children who had experienced different significant losses. For example, children in care, children who have been displaced, have parents in prison, experience parental separation, or experience a parent with a terminal illness. So the list is endless and grief is unique to each individual. So we incorporated different types of losses rather than just grief experiences. We also adapted the intervention to make sure it was accessible for young people who are neurodiverse and also ethically diverse participants. Capacity building was part in terms of delivering staff training and support. And we use PDSA cycles to test and refine our intervention. And I'll talk a bit about the memorial art piece just at the end. Next slide, please. So continuous service user and staff feedback was conducted throughout the whole of the project. We conducted focus groups, we had feedback, in-time feedback, using paper tablecloths throughout all the workshops. We use semi-structured interviews after each workshop with the young people, and we had pre and post questionnaires that they could complete. We also incorporated staff reflections after conducting the workshops, and also the steering group and the operational group feedback as well. So all the information we used was put into redesigning based on the feedback that we had received. Next slide, please. So in terms of our outcomes, so since the initial pilot, multiple workshops have been delivered in 5 schools in total across the trust, and 96 young people have attended the workshops. So we achieved our aim that 60% would report an improved confidence in coping post-intervention. In terms of capacity building, staff following the staff training rated their confidence in providing bereavement support increased from 21% to 79%. And there was also 43 additional requests for one-to-one single session support, targeted support, as well as ongoing referrals sent through. And these were requests made by the young people themselves in terms of meeting that goal for them to be empowered in accessing their own supports at a time when they needed the supports. One of the other outcomes was the attendance at some of the workshops by children who had previously disengaged in schools. So some of the children who were no longer attending schools came specifically in to attend our workshop, so re-engaged back in with the school environment, which was a very powerful, unexpected outcome. Next slide, please. So in terms of our qualitative feedback, so we got rich qualitative feedback. So some of the feedback was used to directly inform the content of our workshop delivery and how we designed it. And then some of the feedback was helped us in terms of knowing whether we were going in the right direction. So some of the themes were around learning and normalizing. So young people provided feedback in terms of they had a greater understanding that grief was a journey. It helped to normalize their feelings and reactions, and then increasing the knowledge of what services and supports were available. Connection was another theme. So young people talked about a reduced sense of isolation and improved peer connections. They enjoyed having permission to laugh without feeling guilty. With that was one of the things that quite a number of them mentioned. They made new friends, they enjoyed group discussions, and they also made connections outside of the workshop. So those connections have continued since in terms of supports for each other. Another theme was around the mix between well-being literacy while processing loss. So the young people reported enjoyment of exploring strengths and skills, as well as balancing that with remembering the person who had died or passed away or the loss themselves. Okay, next slide, please. So just some of the quotes which we'll highlight. I'm going to highlight one in particular, and that's the one in the pink box, which again was another unexpected outcome. So this was from a grandmother who said, "I'm so thankful for the workshop was provided for my grandchildren. It has really helped them and our wider family on their grief journey." So by the young people attending the workshop, this actually encouraged the wider family system of that family to attend their own grief counselling, which again, we hadn't expected in terms of an indirect positive outcome. So we have received overwhelmingly positive outcomes in terms of the quotes from the young people and their families, as well as from the schools where we delivered the workshops themselves. Okay, next slide, please. So one of the other aspects that we did is we were invited to be part of what was called the Involvement Human Library, which was a PPI monitoring event. So it was a fantastic event where the young people who have been involved in the workshops and our steering group, family members and teachers all shared their involvement journey with our project and the impact that the work had on them. And we were pleased to be given, just like Britain's Got Talent, the golden buzzer for the extent of service user involvement, which we had incorporated within our project. although we didn't get any of the gold tickets. Next slide, please. So our learning today, so I'll just highlight a few of our learning. So two of the biggest learning points was the value of service user involvement, starting right from the beginning and throughout the project. And then the second one was around in partnership working, the value of collaboration across the system boundaries. Bereavement is a hidden need and there continues to be high demand. So our project has really highlighted the need for providing intervention directly in relation to bereavement. One of the other points just to highlight was the importance of embedding QI methodology, which provided a structured support which allowed for iterative learning and improvement, and has enabled us to look at how we spread our workshop into other service areas. Next slide, please. So we were very humbled to receive the Picker Experience Network Award, and we feel that the Seasons of Life model demonstrates how compassionate, co-produced and data-informed approaches can achieve sustainable, person-centered improvement across systems. Next slide, please. So where we are in terms of our next steps. So we are for one of the schools, we linked in with our artists in residence. So we have produced a memorial artwork, which was completed with the young people, and that's actually going to be unveiled by the young people in the school next week. We have presented our poster at the IHI conference in March, and we are going to do Southern Trust QI event, which has now been moved to June. So we're going to showcase elements of the workshop to other services and other staff members. So we're hoping that that will generate interest, not just in children's services, but beyond children's services as well. We're continuing to raise awareness about children's grief and the supports available. We have currently developed, so we're establishing a planning group to explore additional funding opportunities. We've developed a business case, and we have excellent, as a result of directly winning the Picker Award, we have gotten excellent support from our senior management within the Trust to maintain this project going forward. And we're also looking to share and spread the learning across other services, which we was planned to do in terms of the next stage of the project. So lastly, I just wanted to do a thank you to everybody that was involved. So I just wanted to highlight what it takes and the cross-boundary connections it takes to enable this project to be successful. So there's been a huge amount of different systems and services involved, and everybody has contributed. So I just wanted to, I know nobody's here at the moment, but I just wanted to say a thank you to everyone for their contribution to this project. That's it. Many thanks.
Brilliant. Thank you so much, Sinead, and thank you for sharing that. Amazing to hear the project again. Wonderful to hear that you've got some senior leadership support as a result of winning, and we hear that quite often, that winning builds momentum and builds that support. And wonderful to hear as well that you're spreading the word and disseminating your learning. If you do have questions for Sinead, please pop them into the chat, and we'll aim to either answer them as we go through, or loop back as we get to the Q&A session. But we will now move on to listen to Ros Simpson from the University of Bristol and the University of Nottingham project, which is about lichen sclerosus guide. And what we are now hearing from are some of our category winners. So as I was explaining, all of our category winners present at our event, and I think there were 16 categories at the last event. Sinead was the overall winner, but Ros and this project were the winner of the Communicating Effectively with Patients and Families category. So Ros, please may I hand over to you.
Yes, thank you very much for the introduction, and thank you to Helen for driving the slides today. So my name is Rosalind Simpson. I'm a dermatology consultant and academic from the University of Nottingham, and I'm here representing our wider group. As you can see on the title slide, that we have collaborators from Bristol and Lancaster, and also patient contributors as well. So we were delighted to win this category, communicating effectively with patients and families, at the awards last year, but even more delighted that our patient contributor, Claire Baumhauer, actually won the award for patients. And that was absolutely brilliant for the work that she's done, the charitable work and support work she's done for patients with this condition called lichen sclerosis. Now, LS for short, it's much easier to abbreviate it. This is a chronic progressive skin condition that predominantly affects genital skin and predominantly affects females. So it affects the vulval skin tissues in the main. And even though it's relatively common, about 1 in 100 women are believed to be affected by LS. It's not very well known about, and there may well be people on the call who've never heard of this before, and that's not unusual. So often people don't know much about it, and that can include healthcare professionals, because teaching and training in this space is very limited, and it crosses over multiple specialties from general practice, sexual health, dermatology, gynecology. And when there's a little bit of something in lots of different specialty areas, often the teaching can be quite disjointed and poor. And so all of this leaves that people with LS struggle with symptoms without being given a formal diagnosis often, and they don't receive timely treatment, and they don't receive good knowledge about their condition. So people feel very lonely and not empowered in how to self-manage their condition. Next slide, please. And LS is often considered an itchy discomfort, an itchy skin condition in the vulval area. It can affect women of all ages, including girls, and the youngest cases have been in the region of 3 years old. But it predominantly affects women of all ages, often in the perimenopausal and menopausal phase. It can also affect men, but we don't have a good grasp on what numbers of male patients there are with this condition. But it causes itching in the genital area, and it can cause pain because there's inflammation, which causes fissuring and cuts on the skin. And this leads to impact on day-to-day function, so walking, sitting, going to the toilet, intimate relationships and sex. And it causes visual changes to the vulval area. It can cause whitening of the vulval tissues, there's bleeding and bruising under the skin, and it can cause thickening of the vulval tissues, which can be very alarming if someone were to see that. But it's not just an itchy skin condition, because LS can lead to anatomical changes. Due to its inflammation, it causes scarring of the genital tissues, which can lead to narrowing of the vaginal canal. And it can cause cancer in a small number of patients who have the condition, particularly those who are undertreated or who neglect to see health professionals or neglect to understand the condition. And the QR code there is a link to a BBC interview with Claire, our patient representative, who only found out she had LS when she was diagnosed with vulval cancer in her 40s. And it's a really powerful story. And I would urge you to scan that QR code and have a listen to her story. It's only a short video, and it's really very empowering. So let's move on to the next slide, please. At the University of Bristol, Sophie Rees, who had actually was the overall lead for this project, undertook some mixed methods research to understand the lived experience of LS in women. And this was funded by the ESRC. And it was a combination of researchers from University of Warwick and University of Bristol. And in that qualitative work, she found that there was missed opportunities for diagnosis and missed opportunities for education in this space of LS. And therefore, there was a need for information, for tools, for self-management for people living with vulval LS in the long term. Next slide, please. And this is what led us to the lichen sclerosis guide, which we're talking about today. And Sophie assembled a group of researchers and patients who were interested in this space. And we were fortunate enough to receive funding, a combination of funding from the Wellbeing of Women, from the British Society for Vulval Disease and the British Association of Dermatologists, where we were able to go ahead and develop this lichen sclerosis guide. And this was true co-production from the very beginning, and the patient members were involved in obtaining the funding process as well. And before we embarked on developing the guide, we undertook a large survey from Claire Baumhauer's support group online, which has over 600 members. And we had a huge number of responses, which allows us to refine the topics that were going to go into the end product. And once we had a list of topics we were going to include, our team members were each responsible for writing and developing a section or sections of the guide. And we developed written sections and we developed videos. And we collaborated with a creative content design company who were able to develop visual products. And we also collaborated with a copywriter, and that was based upon direct feedback from our patient members and when we had feedback from users as well. And we launched the guide in January 2025 on World Lichen Sclerosis Awareness Day. So next slide, please. And this is the product. This is what we developed. The QR code will take you straight to the website. And if we go on to the next slide, there should be a video. Whether it will work or not is yet untested. So let's see if we can hear and see it.
Give me 1 second.
That's okay.
It's definitely there.
It's always a risk to put a video in.
Living with vulval lichen sclerosis, or LS, isn't always easy, especially when flare-ups make you feel uncomfortable, upset, or isolated. That's why we've built a brand new guide full of straight-talking advice and bite-sized videos on everything from what LS is to how to soothe your symptoms and get the support you need. Find us today at lichensclerosisguide.org.uk.
Thank you. On to the next slide. So that was a taster of what the videos look like. And these are some of the other videos that we created on the site, which are more educational on topics which patients wanted to know more about. And we asked our patients what areas we should prioritize to create a video. So they're educational about what is lichen sclerosis, how to use treatments, basic education on vulval anatomy, and also how to check the vulval area, so self-examination to check for signs of disease activity and potential precancerous or cancerous changes. Next slide, please. As well as the written online content and videos, there are downloadable resources which patients and health professionals are able to download and use directly in their consultation. So on the left is a treatment plan. So this is a written treatment plan to support the information given at an outpatient consultation with a health professional. And on the right is a checklist for patients to download and to bring to their appointments to help empower them to speak to their health professional about the issues that are concerning them. Next slide, please. And since launch in January last year, we are really, really proud of the success that it's had. There have been over 330,000 views on the website, and that is from 148,000 individual users from 50 countries. So it's likely that individual users are coming back to the site a couple of times or looking at several pages for their needs. We do have a survey which is available to complete for users of the website, and 121 people have completed it. So it's not a huge number, but of those, 84% have said they feel more confident in managing their condition because of the guide. And there's a lovely comment at the bottom there from a survey respondent who feels that the guide has been factually enormously helpful and very empowering and has given them better control of their condition. Next slide, please. And the last year or so has been spent on promoting the guide and implementing it into clinical practice pathways. And we've attended a number of conferences of key health professionals who would like to use the guide, and we've handed out a number of promotional items for people to be able to give to their patients to use it. And so far, the guide has been integrated with a number of key websites, and it is now available. It's linked out from the NHS information page on lichen sclerosis. It's been integrated into the Royal College of Obs and Gynae advice and guidance templates for patients with vulval problems and with lichen sclerosis. And it is linked out from the DermNet NZ, which is a really big international skin website providing information for patients and health professionals. So it's on that website as well. And we're continuing work to have it included into guidelines, which are currently being developed. We have the opportunity to send out information to health professionals as well if they wish to have printouts of the treatment template, for example, and some business cards that they can order to give to their patients too. Next slide, please. And the next steps are really looking at how the guide can be optimized, evaluating it in a methodologically rigorous way, and also looking to improve accessibility. So far, we have got some translations of the videos into Urdu and into Polish, but we're looking to see if we can create some easy read versions of the material that's on there, and also to improve accessibility for people with additional needs, so for example, visual impairment, amongst others. And yeah, our goal is to really continue embedding it into clinical practice. Thank you. And the last slide is a thank you to the organisations that have supported the guide through funding and through collaboration. Thank you for listening today.
Brilliant. And thank you, Rosalind, for sharing that. Some amazing stats there. Again, if you've got questions for Rosalind, about the guide or next steps or anything that you'd like, please could you pop them into chat and we will aim to circle back to those. Sinead, there's a couple of questions for you in the chat that I think that people would love to hear more about your project and some of the next steps. But if we could move on for the moment to our next speaker. And this is Kajal from Great Ormond Street Hospital talking about the patient bedside engagement service. And this was a winner of the innovative use of technology, social and digital media and data management category. So Kajal, may I hand over to you, please?
Thank you very much for this opportunity to talk about this platform again, which I never get bored of. So thank you very much. You do have to bear with me. I've lost my voice over the last day or so, so hopefully it won't go today whilst I'm talking. So basically, the patient bedside digitization platform was, the need for it came about because we were seeing that the challenges of hospital stays when patients are and families are in long stay isolation periods within the hospital, they're very, it's a space where they're obviously stressed, anxious. They're in a space where there's not much to do in that space. So that was one of our driving factors to begin with. And also one of the limitations that we found with our legacy system was that it was very limited in terms of entertainment, and the lack of integration with the healthcare records, and the experience generally was not as we would like and as patients expected as time had gone on. It was very old infrastructure we had in place, which was about 12 years old, so it was very dated. We came about this idea because we had been planning for this for about 2-3 years before we even launched it. So we've done a huge research around what patients actually want to see on a new platform. We engaged with all aspects of our organisation. We spoke to clinical staff, we spoke to non-clinical teams as well, such as our GOSH school as well, which we are fortunate to have at GOSH. So we liaise with them to see what they would like to see on the platform that could help patients ultimately as well. So that was, that was our driving force, what the patients want at the end of the day. And we engaged with the YPF, the youth committee that young people's forum that we had set up as well. So they were the drivers behind the system that we developed. And the main thing is it's a patient-centered digital system. So, we want it to be a holistic system that it's not just about the entertainment, it's about information, it's about their healthcare, it's about tools and connections to the outside world as well, to make them feel like they are away from him. You can move on now, Helen. Sorry. So in terms of the development and what that included, next slide, please. So this is our homepage. When the patient logs in, when they're assigned a bed space, what we built was a collaborative co-production. As I've mentioned, we've worked across various teams across the hospital. We've worked with patients, carers, clinicians, ICT teams, external partners as well, to ensure we meet the diverse needs that were captured from the patients themselves. The system itself is a touchscreen terminal, and it connects with their healthcare record through the MyChart bedside app as well. And we wanted to ensure it was accessible and inclusive as well. So we wanted to ensure the interface was very simple. It was basic because obviously the hospital was aimed at children, so our patients are children. So we had to keep it simple and easy to navigate through as well. One of the benefits is that we can also connect Bluetooth devices as well, so Bluetooth headphones, any accessibility tools as well. And additionally, we've got various languages for the UI. So I think it was up to about 20 or so different languages that we could have the UI displayed in. So that was also another benefit in terms of accessibility. The entertainment that we provide is we've got live streaming to TV as the usual TV channels. We've also worked with Sky, and we've got numerous HD channels as well, varying from different genres as well. So things like foreign language channels, news channels, children's channels, music channels, it varies. So, there's a lot to be seeing from there. And also the most, I think, compelling thing that the children wanted to see was that there's streaming of apps, because that's the new generation, that's the world we live in now. All the content is now delivered through some form of an app. So one of the beauties with this new system is we can put apps onto this platform, and patients can log into applications that they would like to see, that they would access from their home as well. So things like Netflix, Prime Video, Disney, BBC iPlayer, all those sort of apps, patients can log in using their home controls and accesses to get access to the streaming of content that they are familiar with from home. And one of the other main benefits is it's a scalable system. It's designed for easy future enhancements. It can be implemented across other healthcare settings as well. So it's a baseline for us. We want to go further. We want to take it even further. So this is a starting point. Next slide, please. So this is just an example of what the patient sees. When the patient is admitted onto our EPR system, which is Epic, there will be an alert, a welcome screen on the unit to say, welcome such and such patient, and they need to sign the terms and conditions before they can start using the application. And this is what the interface looks like. So when they first get access, you can see you've got their name, so it's personalized. You've got the care team as well, the bed space they're connected to. And then under My Health, you've got the My Gosh app as well, which is our My Gosh bedside app, which is the app that connects to Epic, and the patient can see high-level healthcare information as well. And then you've got entertainment, which was where obviously the live streaming, the applications and all those things are stored. And hospital information would be things like what's available in the local area, what activities are going on. So for lots of patients, their families are in that hospital space for a very, very long time, sometimes since birth as well. So we've tried to put as much information for the parents to also then find their way around the local area to either take their children if they're well enough to go to the local park or go to get some food or whatever. So it's just linking to other local amenities as well. And then you've got the connect, there's access to the internet as well. So that's also within the remit of the GOSH sort of rules. We don't want them just reaching any old website, obviously, because of safeguarding and governance and all those things. So they are, you've got access to the internet within a safe way as well. Next slide, please. So this sits under our healthcare app there, so on the interface that you saw. So this is basically a nutritional app, so it helps patients to navigate through their dietary requirements. So this is provided by Carbs and Cows, who worked with us and donated this to us. So this is an app that they've produced and we've been able to make available on the platform for the use of the clinicians, so the dietitians or diabetes team, and also for the patients to be able to navigate their own, eating habits and look at the, to manage their eating basically. So this is a really, really useful tool, and it's been welcomed very well by the clinicians especially, and also the patients as well. Next slide, please. So in terms of stakeholders, next slide, please. Yeah. So this picture here is of our chief executive and one of the, what was his name? Andrew something, Gwynns, I think. He was one of the ministers, I think, or someone in government that visited GOSH. And they were looking at the platform, and he was very, very pleasantly greeted with this platform as well. So his feedback was very positive. The project has involved multiple stakeholders, as I've mentioned, from the Young People's Forum to patient advocates, family advocates, staff champions as well, and continuous feedback. So always trying to improve where we can and enhance what we're offering here as well. As I mentioned about accessibility as well, this platform, we want to ensure everyone has access, equitable access to the platform. So anyone with visual, auditory, cognitive impairments, to allow them to be able to use their devices that they would use via Bluetooth to connect to the platform, to be able to navigate through as well. So that was one of our key requirements, really. We wanted to ensure it's as accessible as possible to as many children across the trust. An example of this is recently in November, when on Guy Fawkes Day, we had a fireworks display that was put up with the help of Corums Fields and other parties. And for those patients that were able to leave the hospital, they were able to attend this firework display that was put on. However, obviously there are very high number of children that are unable to leave their rooms, and they were unable to see it. But with the use of this platform, we were able to live stream what was going on in the fields for them to feel like they were part of that experience, and not to feel left out, and to be included. So that was a really nice use case of how this platform has, invited those people that normally wouldn't get invited to these sort of events because they couldn't. So yeah, it was a really nice thing for us to hear. In terms of partnerships for content, as I mentioned, Carbs and Cows, who are our nutritional tracker app, and then we've got Singing Hands as well. I don't know if anyone has heard of them, but they are Makaton they are Makaton. They use Makaton basically to create content. So things like nursery rhymes, stories, and all those things. And they've got videos that accompany the content as well. So patients, again, with accessibility needs, if they have audible problems, they could follow the content via Makaton as well. So, and we've got these enabled on the platform, and the children love them. Even like all children from all ages will spend, you can easily spend ages just going through all the content, because it's all really nice. And they've made their own songs up as well, so it's not just the standard. They have got their own unique songs that they built as well. So that's really nice to have partnered with them, and again, they supported us with this. So as I've mentioned, yeah, it's easy to use. Yeah.
We're starting to be tight on time. Would you
Sure.
be able
Okay,
to
no problem.
just thank you?
No problem. Yep. Next slide. Yeah. So impact and outcomes. So it's improved patient experience. We've worked with the family and friends feedback data, and we've seen huge positive feedback that's come out of it, clinical engagement and coordination, like I've mentioned, and positive feedback and validation throughout the whole trust. And from governance and data, we ensure that the system is robust and it follows GDPR compliance and DPIA for data protection, and role-based access encryption and secure authentication. Yeah, I'll leave it there. Just thank you. And in terms of scalability and what we can do, again, like I've mentioned, it can be scalable across multiple NHS trust departments for long-term sustainability. Collaborations, which I've mentioned, with our Epic, with our carbs and cow singing hands, and many others in the future, that we are working towards as well.
Perfect.
Yeah.
Thank you. And amazing to hear about such a wide-reaching resource for young people staying at Great Ormond Street Hospital. So thank you for sharing, and I'm sorry to have moved you on. I've also realised that I grandly announced that we were finishing at 2 o'clock. Of course, we're finishing at 1:30. So everyone was so polite and didn't tell me I was wrong. So Kajal, I'm hoping that your voice has held out. If there are any questions for Kajal, if you wouldn't mind putting them into chat for her, and hopefully we can pick those up. But for the purposes of keeping us moving, may I now hand over to Faith from the University College London Hospitals NHS Trust, who will share their best practice about high quality care for patients, but through exceptional care for staff. So we were talking about that earlier on, and perhaps unsurprisingly, this was the winner of the staff engagement and improving the staff experience category. So Faith, please hand over to you now.
Yes, absolutely. Good afternoon, everybody. It's wonderful to be here. And yep, I'll be talking today about how we improve staff experience and how that affects our patient experience. So my name's Faith. I work in our staff experience team for UCLH NHS Trust, and I manage a programme called Be Well, which is our staff wellbeing programme. So first things first, I am just one of a huge number of staff who have made this programme so successful. So I just want to say some special thanks, obviously to Picker for helping us kind of get to this point and win this award, and provide the opportunity to kind of share with you all today about the benefits of the programme. Huge thanks to our charity, which has actually funded the programme over the last few years. We also have a huge network of wellbeing champions. We've got over 300 wellbeing champions now, actually 320, I think. And they've also helped us massively to support the wellbeing across UCLH for our staff. Also, we have a huge network of different teams involved in wellbeing across UCLH. So we have occupational health, we have staff spa, we have an arts and heritage team, we have staff psychology and welfare service, staff development, etc. So huge shout out, even though they're not here, to all of the teams involved with us. So next slide, please. So I'm going to do something a bit different. I'm going to take you on a kind of journey backwards rather than forwards. And I just really want to start with the impact, which is obviously the most important. It's, what kind of benefit has this actually had for our staff and patients? This isn't an opportunity to toot our own horn. It's just to say, when we work together, we kind of look at stuff that is led by the staff themselves, and when we pull together to make a big program, we can actually have such huge benefits. So yeah, next slide, please. So this is a new addition. These are results we got just in the last week, which was incredible. We didn't expect this. We have now been voted the best trust to work at in the whole of the UK for the 4th year running. So we actually had more response rate than we've ever had previously. We actually got 6,326 responses from staff, which was 53.63% of our staff. And they've also voted us where they would refer their families and friends for care. I obviously won't go into too much detail. We've got the next slide to talk more about this. So again, last year, we also had a similar thing. We got voted the best trust to work at. And we actually saw it. So this was the submission. So we actually saw an increase in all the different areas, whether it's staff relating, sending their relatives and their patients. Whether it's staff recommending their friends and family as a place to work, or they're saying that the patients and service users have actually voted us top. Yep, obviously this is a really great result for us over the last 4 years. Next slide, please. Also, as part of the staff survey results from last year, we were able to say that we had pushed the dial up on all of the people promises. So our staff said that they were feeling they're able to be recognised, that they felt that the trust was compassionate and inclusive, they felt safe and healthy. And we actually were voted the highest trust in the Shelford group on every single one of those elements. So it's a really great achievement. Next slide, please. We also, like I say, this strongly links to how we support our patients. Obviously, if we have staff in poor health, they can't provide an excellent level of care to our patients. So it was really great to see that in our 2024 National Inpatient Survey, we were given an overall rating of 8.4 out of 10, so 84%, which is absolutely fantastic. And it's really great to see that the programme is having wider benefits. So I'm going to talk a bit more about the programme and actually what we did. After we've got another photo to celebrate the accolades. Last year we also won the HPMA award, which was fantastic as well. Next slide, please. So we've also had support from our chief executive and our head of people. We've really feel very grateful for the amazing support that we have actually at the top of UCLH. We can provide this comprehensive wraparound support because we have such invested support from our seniors around staff wellbeing. Next slide, please. So what did we do differently? So we've worked quite closely with other trusts over the last few years to see what everybody is doing. And it's really great to see there's been some huge advancements across the whole of the UK in staff wellbeing since COVID. And essentially this programme is where this started. It was during COVID in 2020, we realised that a lot of our staff were struggling to access the basics. And so from 2021, we launched the Be Well programme, which is a really comprehensive programme with lots of different work streams that I'll talk about. But it really was to aim to kind of, this might be familiar to people, this is based on Maslow's hierarchy of needs. And it was to make sure that for staff to be able to reach their kind of optimum fulfillment, their optimum productivity, that their base needs were being met, whether it's their basic needs from getting a cup of coffee or being able to access toilets or kind of just having rest spaces, etc. But then beyond that, making sure that they had access to stuff to support their psychological needs, their wider kind of well-being lifestyle, and moving on from there to support their kind of expansion as a productive and happy and healthy member of staff, and also provide that care back to our patients. Next slide, please. So specifically at UCLH, the programme we've designed, Be Well, is designed around the different domains of staff wellbeing. So this is our wellbeing wheel. You can see it behind me as well. And this is a resource developed for staff, which encapsulates all the different work streams that we have across UCLH to make sure that staff have support for every single area of their wellbeing. As we all know, when it comes to wellbeing, whether it's our own wellbeing, wellbeing of our patients, wellbeing of staff, one size doesn't fit all, and we all have different wellbeing needs. It might be that we actually need more support with our finances. It might be that we need some assistance with improving our physical well-being. It might be that, you know, the stresses and pressures of work or home life mean that we need to have support with our psychological needs. So this is an interactive resource that we've provided for staff to be able to kind of very quickly find the services that they need. And I will talk a bit more about the project itself and how those work streams came about and some of the results that we've got specifically. So Be Well itself consists of several different work streams, all known as Something Well. And these include our Wellbeing Champion programme, known as Being Well, Communicate Well, which is our programme to improve the communication skills and the kindness, civility and respect of our staff. We have Eat and Hydrate Well, which does very much just what it says in the tin. It's to improve the nutrition and hydration of our staff. We have Feel Well, which is to improve the psycho-emotional and social well-being of our staff. We have Finance Well, which is obviously support financial well-being. Lead Well to support managers. Relax Well, which was a Joy at Work fund to support staff to access funding for specific initiatives that they decide that they feel is best for them. And then we have Rest Well, which was to improve fund to improve staff break spaces. Share and Support Well was to implement Schwartz rounds, which were a safe space for staff to come to share the challenges of working in the NHS and provide support. It wasn't a place to go and get anything fixed, but just to be able to kind of discuss challenges and feel kind of supported by peers. And then we had our Work Well Anywhere programme, which was Be Well contributed to a huge programme across UCLH for supporting flexible remote working. So we can't take the full pride for that one, that piece of work. It was actually collaborative. I mean, all of these pieces of work have been collaborative, but we contributed to that. And we also had our Work Well together. So we recruited teams of business partners who work really closely with teams that are struggling to repatriate or were struggling to repatriate after COVID, and kind of work with them on any kind of kindness, civility and respect challenges, senses of belonging, connection, communication. They tended to bring together actually all of the work that we've been doing to signpost staff to those things. Next slide, please. So this is a visual of the whole programme itself. As you can see, there's lots of different work streams, and underneath each of those we had several other different work streams that have stopped and started over the few years. So with Being Well, we largely focused on making sure that staff came to the programme to join to be a wellbeing champion were onboarded really smoothly, that they had meetings that they could access really regularly, and most importantly was the access to a wellbeing champion wellness fund, which has been so incredible. It basically has given staff the opportunity to take funds that we have within Be Well and do initiatives within their area that they feel are very specifically beneficial for their area. So we've had we've done all sorts of this. It's been amazing. So some people have done Employee of the Month awards. Some people have done, so we worked really closely with radiotherapy and proton beam team because they were really struggling with low morale. They work in a kind of underground, like dark environment, had lots of kind of staff changeovers, lots of changes to the process. And so we worked with them really closely and given them access to the Wellbeing Fund to create like a Wellbeing Wednesday winter series where they had mindfulness sessions, a drop-in spa therapist to come and offer things like reflexology. We did all sorts. I'm just waiting for the results back from the staff survey to see how much that has increased on the results, but I can just see with my own two eyes that the this has had a huge impact on the team. We went from 1 wellbeing champion to 10, and they now have an annual calendar of different wellbeing events that they didn't have before, things like Eid celebrations or sports days, just all sorts of stuff, and it's really wonderful to see. That's just one tiny example from one of the food divisions that we've worked with. For Communicate Well, we had a programme to recruit and train mediators, and then we also recruited and employed a mediation lead, and they have had such a profound impact on creating a culture of kindness and early conciliation in the trust, which has just been incredible. There's been loads of training courses run for staff on mindful communication and conflict coaching. It's just been incredible. We've also been developing a restorative process in the trust, which is incoming, so that people can, when there's really entrenched conflict, or when there's kind of issues around blame and isolation, those things are managed really sensitively. So really, really phenomenal programme. For Eat and Hydrate Well, we did lots of small things like deliver reusable water bottles, and I created what we affectionately call the P Well poster, which is a poster on how to recognise if you're in signs of dehydration, to remind staff to make sure they get a cup of tea soon. But also the biggest outcome from this piece of work was the smart fridges that we spent 18 months taking our time to install. But those essentially are an out of hours access, so they're a cross between a fridge and a vending machine, and staff can access meals that they can go and take away and put into the microwave. So that's been really, really very well received. There will be more evaluation data in a later slide that I won't be able to go into fully, but you'll be able to investigate to see the impact of that. We also, as part of Feel Well, had an employee assistance programme. We supported our staff psychology and welfare service to expand their services, which we used from a second year of funding from our employee assistance programme that wasn't particularly beneficial in the end.
Faith, I'm conscious that people want to see your other site as well. Can I ask you to move on a little bit, please?
Yes, no worries. Of course, I could talk about it forever. No worries. Next slide, please. Yeah, so all of the work streams that we implemented as part of Be Well, we discovered very nicely aligned with the Health and Wellbeing Framework from NHS England and with all of the NHS People Promises. It's been really fantastic to know that these are actually all in alignment with the national kind of agenda for wellbeing. Next slide. And so some of the data that we found, we've now got a wellbeing champion in every division, and that's been really supportive in the staff survey, with staff feeling like that we're taking action, health and wellbeing. We've had loads and loads of staff attend training, as I've said. For Eat and Hydrate Well, 74% found those that were using it that it improved out of hours food access, and 89% of respondents expressed improving their wellbeing. There's lots and lots of data here. Maybe go to the next slide. Sorry, there's just so much to talk about, such a huge programme. We found for our Rest Well, of all the different items that we purchased for break spaces, this improved staff experience, morale, well-being. For Lead Well, we've noticed in the staff survey that there was a 5.3% improvement in staff well-being, staff feeling that their immediate manager takes an interest in well-being. I'll skip on to Work Well Anywhere. So in the staff survey, we found that the staff are feeling more trying to rush too quickly. Staff are feeling that UCLH is more committed to helping staff balance their work and home lives. Like I said, it's worth looking over the slides later, just so you can kind of take a closer look at each of those bits of data. Next slide, please. So then there's just a couple of photo galleries here. This is all of the wonderful photos from our Joy at Work programme, which was, like I say, the programme where we give money to staff to do all the different things that they feel that was most beneficial for them. And this is us doing some road shows. It's some of the nice things that our wellbeing champions have done. Like, we've got some little treats here from wellbeing champions on Valentine's Day. So yeah, it's just been a really, really incredible program. And I really wanted to just point out, having seen the themes that you said were emerging, all of this entirely is, as you can see, based on all of the things that staff say that they specifically need. So everything we do is based on monitoring of how staff are feeling and what it is that they're needing, and if we need to change anything in the program. Everything is co-produced with staff, it's by staff for staff. And we're obviously looking at the long-term sustainability of the programme, which winning this award is really, really helping. I'm writing an evaluation now, which highlights all of these benefits and the more we've just seen over the last year. So thank you so much. I'm sorry if I talked too long.
No, brilliant. And thank you so much for sharing that. I know there's going to be some questions. So again, if you could put the questions into chat, just as we make sure that Sarah and Zoe are ready, because I'll hand over to them in a moment. All of the slides will be shared afterwards, but everything is on our website and in our book of best practice, which we'll pop the link into. So if you want to go and find out a little bit more about these presentations or read about the submissions, it is in our book of best practice. So thank you very much, Faith. So moving on to our last presentation, I'd like to hand over in a moment to Sarah and Zoe from Leeds Teaching Hospitals NHS Trust, who will be talking about supporting every smile. These were the winners of the Environment of Care category, and with no further ado, I'll hand over straight away to you, Sarah and Zoe.
Thanks, everyone. Thank you, Ruth. So afternoon, everybody. My name's Sarah and this is Zoe, and we'd like to share with you our initiative to improve the patient journey for neurodivergent children and young people, and also those with additional needs attending the Leeds Dental Institute. Next slide, please. So just a brief outline over the next 10 minutes or so of what we'll be covering. So we'd like to give you some background as to why we felt this project was needed. We want to discuss our Learning Disability and Autism Champions group and the projects undertaken so far within the Paediatric Dental Department to improve our patient journey, and including the reasonable adjustments pathway. And we also want to highlight the successes and impact that this has had within our service. Next slide, please.
This slide is a bit old now, actually. It's from 2024, before we started the project. It's essentially to highlight that we see a lot of autistic children and children with learning disability. So it's probably about an average of 23 a month, and about 25% of our new patient referrals. And these are only the children and young people with confirmed diagnoses. There are many more that we see that are undiagnosed or who are on really long waiting lists for assessment. And many of these children will have additional sensory or communication or behavioural needs that we need to make adjustments for. Next slide, please. Unfortunately, there have been occasions where we weren't prepared. If you can click on, if we've had a few Datix reportable incidents, if you can imagine, the dental environment is quite challenging for someone with sensory differences, sensory processing differences, bright lights and funny smells and unpredictability can lead to sensory overload, and then sometimes distress and anxiety and challenging behaviour. So the year before we started the project, we had 6 Datix reportable incidents where a child or young person had harmed themselves or others when they've become overwhelmed. This understandably can decrease staff confidence and also the patient and carers' trust in us. And failure to consider adjustments can also lead to was not brought and cancellations, including for treatment under general anaesthetic, which can lead to treatment delays and wasted resources, and also potentially safeguarding concerns. Next slide, please.
So what we did is that we set up a Learning Disability and Autism Champions working group. And these are people, and you can see us all photographed there. You can see that we are across all departments within the Dental Institute. And we're all working together to improve accessibility and experience for this patient group. So today we'd like to share some of the projects that we've carried out. Now, this is specifically within the Paediatric Dental Department. There are other ongoing projects within the adult services as well, but we're just going to talk about the peds projects today. So these are some of the projects delivered so far. We've acquired some charitable donations from the charity Starlight, who've given us some sensory items and toys that we're currently using across the paediatric dental department within the hospital, but also our satellite hospital, Chapel Allerton, as well as our day case unit as well. We've recently acquired some more charitable donations through Leeds Hospital's charity. So a big donation from them. So very kind of them to give us some more items and toys that we can use. We've developed some posters of different dental procedures, and you can see Zoe's son there modelling the nasal hood for inhalation sedation. We've developed some patient information leaflets on having a general anaesthetic and visits to the dentist to prepare patients prior to their dental treatment. We've been working closely with our families to develop these sort of social stories and patient information leaflets. And last year, we received charitable funding through Leeds Hospital's charity for a reasonable adjustment initiative, which has involved setting up a telephone clinic alongside some other projects. So Zoe will discuss a few of those in more detail now. Next slide, please.
So the reasonable adjustments project, as I say, was this kind of specific project on its own, funded by Leeds Hospital Charity, and the aim was to try and develop a sustainable reasonable adjustments pathway, whereby we could identify all our new and existing children and young people with confirmed or suspected learning disability or autism. And we wanted to offer those families a telephone call, a reasonable adjustments telephone call before their first visit with us, or if they're on our general anaesthetic waiting list, to offer them a call before their operation date. So the telephone clinic is up and running. We have found that it was originally every other week. We're needing to add more clinics in because we've got such a huge demand. We've created a really detailed pathway SOP and call templates that hopefully anybody can step in to do the telephone clinic. And in fact, other departments in the hospital are hoping to set up their own clinic, for example, the orthodontic department now, which is really great. So and we're also looking at making it nurse-led so that we can increase capacity further. So essentially for our new patients, we try and take a full medical and dental history over the phone, in addition to discussing sensory needs or triggers and likes and dislikes, and of course any adjustments that we might need to make. So we get all that information over the phone, so that hopefully it's just a short time that the child has to be in clinic, because often all that chit chat while they're waiting around is where we lose them. So there's a telephone clinic. We're still looking at setting up the virtual clinic for families where it might be too distressing to even come into the hospital. And there's some on the next slide, please. Thank you. So yes, there was another social story, and this one was actually co-created with one of our families who felt that there wasn't enough information out there for them. So it's actually their autistic son who features in the leaflet. We've made some video walkthroughs to prepare families of our 2 different clinic sites at 2 different hospitals. The paediatric dental web pages we've created with lots of really useful links and resources, and an accessibility section. This learning resource created for our new clinician starters, but also the admin and nursing team, and that's been delivered, and we've assessed levels of how confident they feel following that intervention. And we're still trying really hard to get a play specialist dedicated for the dental team. Next slide, please.
So the success and impact following this initiative really is that we've received some excellent feedback from patients, caregivers and staff, both informally and also through structured questionnaires. For the sensory items and toys, 100% of respondents reported an improved patient outcome since they've been introduced within the clinics. We've collected some really nice case studies and patient stories to capture lived experiences. We've seen a reduction in Datex reportable incidents, including children and young people with learning disability and autism. We've noticed general anaesthetic cancellations on the day due to behavioural challenges have been reduced from 8% in January to May of 2024 to 2% in the same period in 2025. Audits show that we have improved significantly in our documentation of reasonable adjustments for children and young people with a confirmed diagnosis. And as Zoe alluded to before, we now deliver sort of, for new starters, a learning sort of package for postgraduate dentists, new nurses, the admin team. And we really feel that this is improving sort of knowledge and understanding across the department. So that's brilliant. Next slide. So this, sorry, I know it's a bit busy, this slide, but I'll let you read it. I'll just fill you in a little bit. This is feedback from the parents. One of our parents, she has 2 autistic sons. The older son had a general anaesthetic with us, and they hadn't had a great experience, unfortunately, because they felt that they were in the dark about what to expect, but also the ward weren't prepared. There were delays, and it was distressing for everyone involved. So when her youngest son, we told them that he needed a general anaesthetic, she was a little bit apprehensive, but he was able to go through the reasonable adjustments pathway. And yeah, I think they were really pleased with how it had gone. So yeah, and we've had some nice patient stories. The charity have been keen to show how well this initiative has done. Thank you. I think next slide. Thank you very much. And if you've got any questions or any sort of queries, we've got our emails there if anyone wants to contact us. Thank you.
Wow, thank you so much, and so much food for thought in the presentations today, and finishing off with some really interesting ideas, and how can really powerful metrics as well of things that you've made a difference on. So thank you for sharing. It's been a bit of a whistle-stop tour across some amazing examples of great best practice. We've put the book of best practice into the chat. We have encouraged questions. I can see some of the questions are being answered in the chat. We've only had 3 minutes, so if you do have another question, please pop it into chat. But just as we move forward to any questions or thinking about how we're going to tackle those, I noticed that there's also some questions in the Q&A, and it's an observation actually which has come through quite a lot, which is quite a lot of this funding of the projects is coming from charitable funds or specific funds. So one of the questions I'm sure may be, well, how do we get that kind of funding? And of course, we had a funding or accessing funds webinar only last week, I think it was. So it may be that some of those questions are answered there. Any final questions or comments, please pop them into chat and we will aim to pick them up. But in the book of best practice, as I have said, the contact details for the lead for the project are there, and they know that they may be contacted. And of course, in the slides, you can also see in many cases the immediate contact details. It feels to me like there's some work here that really should be shared. So Helen, if you move the slides on, please, then. So as I said, anything that will be raised, we'll pick up and we'll just make sure that we send it out as follow-up following the conversation today. So just to wrap up, massive thank you to our speakers. It's been amazing to hear your best practice again. I know you shared it at the awards, but part of today's goal is to make that more widely available, but also to have the opportunity to hear what's happened since. And it's amazing to hear, so much of the work is starting to build momentum, get even more traction, and wonderful to hear that being recognised has meant something back to the teams in your organisations. So we'll share all of the slides from today. Please do go and have a look at the book of best practice, which we'll also make sure we share. And then the webinar recording will be available to everyone who's taken part and signed up, but it will also go up onto our webinar, onto our website. And we will be planning to do some extracts over Patient Experience Week, which is the week of the 27th of April. So if that's not on your radar, perhaps it should be. We do have a set of resources available on our website for you if you want to do some things in that week, including some ideas of what you might want to do. And I think from Faith's presentation, there may be some ideas coming out of there as well of what we can do for our people. So on that note, I think then just thank you. Thank you for joining us. Thank you to our speakers. And please do get in touch if you've got any questions or any feedback. And if you do have any best practice out there, we'd love to celebrate it as part of Patient Experience Network Awards, Vicar Experience Network Awards this year. So please do explore whether you should enter. And thank you everyone for today. And goodbye.